Hello, I'm Dr. David Cohn. Today I'm going to talk about the health dangers of electronic cigarettes, or e-cigarettes, commonly known as vaping. While some claim that e-cigarettes are not as dangerous as normal cigarettes, it seems they may not be as safe as initially thought. In fact, an outbreak of lung injuries as well as several recent deaths have been linked to e-cigarettes, prompting the Centers for Disease Control and Prevention, or CDC, to caution people against using them. An e-cigarette works by heating a liquid to produce an aerosol that users inhale into their lungs. The aerosol penetrates deep into the lungs and includes water vapor, as well as any number of additives. These can include nicotine, food product flavoring like strawberry, vanilla, and lime that has been linked to a serious lung disease, cancer-causing chemicals, and heavy metals like nickel, tin, and lead, as well as the marijuana derivatives THC and CBD. As of November 2019, at least 2,172 lung injury cases associated with vaping have been reported to the CDC from 49 states, the District of Columbia, and 1 U.S. territory. In addition, vaping has been associated with at least 42 deaths in 24 states. The majority of the patients have been men under 35 years old. Although most of the cases of vaping-related lung injury appear to be associated with the use of THC-based products, no single ingredient has been identified as the cause of the illnesses so far. And some patients have reported use of nicotine products only. Although research is still underway, the CDC has identified vitamin E acetate as a chemical of concern among people who have had lung injury associated with e-cigarettes. To further complicate matters, many of the e-cigarette products and substances can be modified by suppliers or users. Some users may not even know what's in the liquid solution used in vaping. Unlike exposure to tobacco smoking, which can take years to result in noticeable negative effects, individuals who experience respiratory problems as a result of vaping sometimes develop them within a few days or weeks. Patients experiencing lung injuries associated with vaping have reported the following symptoms: respiratory symptoms such as cough, shortness of breath, or chest pain, gastrointestinal problems such as nausea, vomiting, abdominal pain, and diarrhea, as well as fatigue, fever, or weight loss. Some patients have reported that their symptoms developed over a few days, while others reported their symptoms developed over several weeks. Some mistakenly attributed their symptoms to the flu. As the CDC notes, a lung infection does not appear to be causing the symptoms. Even prior to the recent outbreak, the use of e-cigarettes has been unsafe for kids, teens, and young adults. Most e-cigarettes contain nicotine, which is harmful to developing brains. Additionally, nicotine is highly addictive, and young people who use e-cigarettes are more likely to smoke cigarettes in the future. While there are ongoing investigations into the recent lung injury outbreaks, the CDC recommends e-cigarette or vaping products should never be used by youths, young adults, or women who are pregnant. It's important to note that although vaping is more popular among younger adults, older adults over age 65 who have an existing lung problem, such as chronic obstructive pulmonary disease or COPD, are at an increased risk for health consequences related to e-cigarettes. Adults who do not currently use tobacco products should not start using e-cigarette or vaping products. The best way to avoid potentially harmful effects of THC is to not use it, including through e-cigarette or vaping products. If you have recently used an e-cigarette and experienced symptoms, or you recognize these symptoms in someone else, it's important to see a doctor right away. Your physician will review your use of e-cigarettes, especially vaping of THC. He or she will then perform a physical exam, including measurement of blood oxygen saturation, order a chest x-ray and possibly a CAT scan of the chest, and decide on the need for hospitalization based on concern for lung injury related to vaping. While some patients have made what appears to be full recoveries after a vaping-related illness, the long-term consequences of the lung injuries are unknown.